In this video, I want to discuss the kidney. Now, we have a kidney on a plaque with several of the urinary structures and smaller details. But on this kidney, we can see generally everything we have to know. There are a few structures that aren't well depictable, such as the renal sinus that would be found in here, barely depictable, not a highly discernible structure. If we begin on looking at the kidney, the brown outer layer of the kidney, the renal capsule surrounds it, a fibrous capsule that surrounds the outer layer of the kidney. If we go next, you will see this kind of peachy colored material inside of here that looks spongy on this model. This is representing the renal cortex, the outer rind of the kidney. Now, if we try to look, that there are projections of cortex that pass between these pink structures called renal columns. Now, they are passing between these pink fan-shaped structures known as renal pyramids. Now, a renal pyramid will come together with a portion of renal column to form the lobes of the kidney, renal lobes. And on these renal pyramids, they will come to a tip called the renal papilla, the tip ends. And the papilla will dump into these small structures here and here, known as the minor calyxes. And these are like funnels that will take the products of urine and funnel them down. They go from here to here, or two minor calyxes. They dump into one major calyx. And a major calyx will then dump into the renal pelvis and out the ureter. Now, these tubes all helps us to drain this. Now, the other structures of the kidney that we have to see beyond the ureter and the urinary structures is the vasculature, which brings the waste products in and out as the kidneys filter waste from the blood. And we will begin ourselves with the arteries here. We can see this. We already know this from the circulatory system. This is the renal artery. The renal artery will come in. There's a left and right, so there are two kidneys. This will come in and become this segment from here, this artery, known as the segmental artery. The segmental artery will continue on passing between two lobes, and this is the interlobar artery, as it will go up and superior to the base of a renal pyramid, where it arcs over in this arch called an arcuate artery. Coming off the top of the arcuate arteries, projecting upwards into the renal cortex, radiating outwards, is cortical radiate arteries. You may also see them called interlobular arteries in some texts, but we will call them cortical radiate arteries for their ease of identification. And here we can also see an arcuate artery here. Now, what we can't see are the venules and etc. that do continue on in the vascular pathway of the kidney. But as we look at the vessels in terms of veins, we can see here the renal vein. Now, note that there is no segmental vein. There is no segmental vein on this in the kidney. We become the interlobar vein, arcuate vein, and cortical radiate vein, one of them seen here. Only one depicted on this model, a cortical radiate vein. Now, some other structures that we can see on here, you can see parts of the collecting ducts and the loop of Henle, the papillary duct, and we can see a bit of it. Papillary ducts will be sitting here just as reference for the future. But this is just looking at the kidney. We'll look at the nephron in later videos, and you guys will be able to look at these structures. But this does a good job of depicting most everything you have to know in your structure sheets, especially for the 2011-2012 semester year. And this concludes my video podcast series on the kidney. Look over and review these structures if necessary. The models are always available in the library.